Hi everyone, welcome to another episode of my content creation. The last time I posted a video, someone requested for detailed explanation on clinical data. So today we'll be talking about clinical data with real life example. Now, what exactly is clinical data? Clinical data is any health information collected about a patient during medical care, that is, during the patient's visit to the hospital. Now, clinical data tells you story of what is wrong with the patient, what doctors found about the patient, what treatment was given to the patient, and what happened after treatment. Now, think of this clinical data as a patient history using these four words I just mentioned about clinical data. For example, step one, what is wrong with the patient? As soon as the patient walks into the hospital, he will go to the record department where his file will be retrieved and taken to the nursing's station for his vitals. His vitals will be checked, such as blood pressure, let's say 170 over 100, then temperature at 7 degrees Celsius. His pulse rate too would be taken, and weight too. Sometimes weight is being considered. So now, all these vitals are recorded as clinical examination, and then the folder will be passed on to the doctor's office, that's the consultation room. Now, the step two says what doctors found about the patient. As soon as the doctor sees the vitals, the doctor begins to suspect hypertension. The doctor begins to suspect hypertension, and then he would want to ask her more history about her. He would want to have history about the patient, like maybe if they have any history of hypertension in her family, maybe from the mom or from the dad, because hypertension could be hereditary. You get, and he would want to ask if they often take salt. He would want to know how often they take salt in the family and how often the patient does exercise. The doctor would also want to ask the patient to go and run some tests, like blood tests, or maybe MPY-DAL, cholesterol test, kidney function test, and so on, so that he would know what to commence. So now the next is what treatment was given to the patient. Now, after the test results, the doctor would review the test results. The test results now are also recorded as diagnostic clinical data. So now doctor use the results to proceed for prescription of treatment for the patient. So the doctor would want to maybe prescribe amlodipine, maybe 5 milligram daily, or lisinopril, any other hypertensive drugs that he may likely prescribe for the patient. And he may likely also give the patient lifestyle advice, like counseling on how to use salt. He may, depending on the condition of the patient, he may want to tell the patient to reduce salt intake, and he may want to tell the patient to stop taking salt, and he would also counsel the patient on engaging in exercises. So now this doctor's prescription or treatment is also recorded as treatment clinical data. Now the fourth one is what happened after treatment. What normally happen after treatment is just follow up. So as a hypertensive patient, the doctor would always place you on follow up to monitor your BP. For example, after the doctor has treated the patient, like he would ask the patient to come back after 1 month so that he would evaluate all the treatments that she has undergone. Maybe he would check, he would want to check her BP to compare with the last BP he took. The last BP was 170 over 100, and maybe after 1 month that she came back to the hospital, it has been reduced to maybe 130 all over 85. So you see, there is improvement in the treatment. So clinical data helps you to know the flow of treatments that has been given to a patient. So now the outcome of the treatment will be recorded as outcome clinical data from the nurse's vital sign to the lab test, which is recorded as diagnostic clinical data, down to doctor's prescription or treatment, which is recorded as treatment clinical data, also to follow up after treatment, which is also recorded as the outcome of clinical data. They are all recorded as clinical data. And then, why do all of these records really matters? They really matter because you would want to know how many patients have BP in the hospital. You would also want to know which drugs controls BP better and faster, and also you would want to know common risk factors like the intake of salt and any family history. And also it matters because it helps the hospital to reduce hospital complication, and it also improve treatment guidelines.